Hello, this is Dr. Ken Feiner at San Luis Rey Equine Hospital. Today we're going to talk about acupuncture and chiropractic and its potential for complementary use in horses. The term acupuncture comes from two words, acus and puncture, meaning needle piercing. The practice is about 3,000 years old, according to old documents, but has been in its modern form for the past 1,000 years or so. It comes and is a part of traditional Chinese medicine, or TCM, but even in China, the practice has been historically in and out of favor over the centuries. In TCM, the idea historically is that acupuncture or needling regulates the flow of qi through meridians at specific points in the body to balance the light and dark part of qi, called yin and yang, and that it's the needling that allows you to balance and to control that flow. Modern theories vary as far as their reasonings behind it. We'll talk more about that a little bit later in this lecture, but there are some interesting correlations between modern theories and what acupuncture might be able to do as a complement. The term chiropractic comes from two terms, chiro meaning hand and practic meaning action. The foundation for chiropractic was developed in the 1890s by D.D. Palmer. He had an idea that the body had a so-called innate intelligence, and he thought that adjustment of the spinal column would allow for optimal nerve conduction and be able to reset or reestablish or re-establish this innate intelligence, and therefore the body would then be resistant to diseases and other problems. There are many different types of theories as far as why chiropractic may work, and we'll talk a little bit more about those later too. There are several reasons for considering some of these complementary treatments when we're dealing with a patient. Both of them tend to deal with achieving overall balance in the patient. It's sort of a warm versus cold or near versus far approach of getting as close to the patient as you can and looking at the patient as a whole. We have to be honest with ourselves that there are some limitations to modern medicine, and one of those is we do get oftentimes focused on one specific problem or set of problems. And whereas Eastern medicine has typically focused more on the individual as a whole. So in using some of these as a complement, we can oftentimes add that into our toolbox of treatments that we can utilize. It's important to consider these complementary treatments rather than alternative treatments. Alternative treatments tends to suggest that this is an alternative or a completely different direction from what we call modern medicine, but they can be very useful when they're used as a complement in complement with one another. There's a few fairly old texts on the use of acupuncture in horses, and they do list the common acupuncture points in a horse, and usually in acupuncture those points are along lines that sort of run somewhat irregularly over the body. Those lines are called meridians, and these meridians are not often associated with specific anatomical landmarks or structures, and are spoken of in much more general terms rather than related to specific anatomic parts that we are familiar with. In the use of acupuncture, there are numerous different types of modalities that are used in the hopes of enhancing and prolonging their effects. There is acupressure, which is deep pressure placed over the acupuncture point, usually associated with a deep massage as well of the area. There is the more traditional needling, placing a needle under the skin and oftentimes along with some manipulation of the needle left in place for anywhere between 5 and 30 minutes. There is a procedure called moxibustion, which involves putting an incense-like powder on the tip of the needle, generating heat, but also considering that in traditional Chinese medicine there is a metaphysical component or spiritual component to this. There is some thought that the actual just process of burning the incense seems to help redirect the flow of qi. There is electroacupuncture, a more modern and a little more involved, or at least more severe form of that, where actual electricity is put through the acupuncture needles. Oftentimes you can see in these horses muscle contraction or fasciculation in response to that, again, to enhance the effects. There's also an injection or bead acupuncture, where either something relatively innocuous like B vitamins are injected, or a bead is actually placed aseptically or with sterility underneath the skin through a large bore needle, again to prolong the effects of the acupuncture. Usually it's not recommended to inject steroids or anti-inflammatories, because the idea is that you actually do want to try to induce a little bit of a low-grade inflammation in and around the acupuncture site. Reflexology or zone therapy is another form of acupuncture, where different parts of specific parts of the foot, of the ear, or sometimes the mouth or lips is associated with different parts of the body, so that acupuncture points are put into these points specifically to treat not local effects, but actually other effects, other organs and systems in the body. Another couple relatively modern types of acupuncture. One would be laser activation, where a low-level laser is used to activate the site. And another is mesotherapy, which is sort of, I guess you'd call it a shotgun acupuncture approach, where small doses are put in rows along usually the back to help with back soreness, in effect to cover larger areas of the back. As I mentioned before, there's quite a few different proposed mechanisms of action if we look at acupuncture from a more modern medicine or Western approach, and they go into a couple different categories. It's important to try to think about how some of these treatments may have gotten started, and there is some thought that some individuals, possibly with chronic pain that may have been injured in a fight or a battle or in some other way, that had some type of chronic pain, may have been injured by a spear, say an arrow or a needle, that noticed a reduction in their signs of chronic pain. Hard to know, of course, if that was related to a systemic effect, a local effect. Just having a needle or a spear sticking out of your chest might make me think less about my arthritic knee, but definitely there seemed to be enough evidence in their minds that they wanted to try to develop a system of medicine that would deal with this. And so in more modern scenarios, the types of pain that have responded best to both chiropractic and acupuncture have been primarily chronic back pain, some possibly improvement with some degenerative conditions such as arthritis, or at least the pain of arthritis, headaches, things like that. And we do find that there is some relationship between trigger points, which are basically speaking points on the body along these meridians that trigger a response or that seem painful to pressure, that we use as an indication of a place to treat using acupuncture. And looking at these acupuncture points and trigger points, there has been shown to be up to a 75% relationship with one of a couple different types of structures in the body. Things like neuromuscular junctions, where the nerves enter the muscle cells, musculotendinous junctions, which have a lot of proprioceptive receptors. Those are proprioceptive receptors, are the ones that tell your joint and body and muscle where it is in conjunction with the rest of your body, sort of a positional system, if you will. And other nerve bundles, subcutaneous, throughout the body. So that could trigger actually a local response that helps with pain and or muscle spasming and tension. Or there may be other effects having to do with the release of endorphins, serotonin, etc., These are neurotransmitters that are present in the brain that help to regulate pain. These local effects can be seen best by taking a look at the anatomy of the spinal cord and the spinal nerves and the input and output through the spinal cord through these nerves. As you can see on the right hand side, there are proprioceptive receptors in the tendon and musculotendinous junctions that give input to the contraction and length of contraction of a muscle. They go through the spinal cord that then come back into the muscle through the neuromuscular junction to regulate contraction and relaxation by input by inhibitory nerves. That's most easily observed, most familiarly by most people as one of the spinal reflexes with your knee when your doctor hits the tendon underneath your knee, signaling to your muscle that it's supposedly relaxing, which makes it reflexively contract. The same thing happens in the back muscles, which is where most of the, as we mentioned before, beneficial effect of chiropractic seems to be involved with. And so the needling may actually increase the relaxation input or decrease the contractile input at these neuromuscular junctions and musculotendinous junctions. That would be how they would most likely exert a local effect that helps spasm and chronic pain. There may also be central effects of acupuncture. There's not really a lot of good studies to help confirm this, but there are many examples of specific sensory inputs that can sometimes change the levels of many of the different neurotransmitters that are present in the brain and central nervous system that are released at synapses and that help to regulate pain responses and possibly even chronic inflammation. As mentioned before, chiropractic was actually developed by D.D. Palmer, and it was his son who opened the first chiropractic teaching clinic and did start working on animals early in the 20th century. Chiropractic focuses primarily on manipulation or some type of thrusting to the spinal cord and the nerves associated with it. So sometimes can be manual manipulation that's done versus using a sort of an artificial thrust mechanism, most commonly called an activator, both of which are designed to deliver high velocity but low amplitude thrusts to move the vertebrae and the vertebral articulations, that is the joints between the vertebrae. Again, going back to the anatomy, you can see in the cross-section and in the dissected view on the right the very close and intimate relationship anatomically between the vertebrae and the associated nerves, both the spinal nerves coming out of the spinal cord, the sympathetic trunk that's related to that, and the ganglia that run along either side as well. There is a chiropractic concept called the subluxation complex, which is a historical concept and very widely debated as far as its significance, whether it's actually a true syndrome, whether it really is describing or is the best way to describe what is going on and what chiropractic actually helps. But it's generally agreed that the complex is basically composed of four different things: pain and tenderness, some amount of asymmetry or misalignment, a decreased range of motion, and changes in the muscle tone around that area of the spine. The idea of chiropractic is to induce a small and relative movement of vertebrae that is designed to sort of reset, is the best way to put it, the input that the muscles are getting from this autonomic nervous system and from the proprioceptive receptors that help keep the spine in alignment by, again, trying to balance the contractility and tone in the muscles that are laying alongside the spine. Whether using an activator or doing manual chiropractic, The idea is to try to, again, reset the memory to these muscles and to the spine and to the nervous system. And that usually involves running from the front of the horse back to the back of the horse, each time hoping to get things reset and realigned and reestablished in balance, working from the front to the back until that balance is reestablished. There's actually quite a number of different manipulation and massage type of modalities that are employed. It's easy to find 30 or 40 of those just by looking on the internet. But some of the most common ones as far as horses goes that you'll see out there are deep muscle massage, rolfing, structural integration, myofascial release, trigger point and acupressure, oftentimes termed shiatsu. Again, that kind of goes back and shows the relationship between chiropractic and acupuncture, and that there may be actually similarities between the two, and certainly are similarities in the types of issues that you can address with them. For chronic back pain, usually the most common treatments include things like muscle relaxants, non-steroidal anti-inflammatory drugs, immunomodulators. These are oftentimes given for chronic back pain, but oftentimes are short-lived, since back pain can oftentimes be secondary to other issues, anything from poor saddle fit to inexperienced riders being heavy on the back, too heavy, or changes in conditioning schedules, things like that. But probably most commonly what we see are very low-grade hind limb lamenesses, oftentimes subclinical, that can result in mild gait changes that can result in chronic back soreness. And to really be able to treat chronic back pain, you have to deal with those underlying issues first, or the relief that you get, regardless of whether you're using some of the medical treatments versus some of the complementary treatments. It's going to be temporary. So the goal, regardless of which direction you're going, or including all of them, is to get the muscles to relax into a normal tone, to reestablish circulation, prevent spasmings, sort of reestablish an equilibrium in the muscles in the back, thereby reducing the chronic inflammation, reestablishing circulation, and keeping that self-perpetuating cycle from continuing. There are several legitimate uses of complementary medicine. Certainly there are limitations as well. Unfortunately, there isn't an abundance of scientific evidence that really supports the efficacy of some types of complementary medicine, including acupuncture and chiropractic. But these modalities are very difficult to test, both from a testing standpoint and even in retrospective studies where they look back at different treatments that have been tried. Oftentimes it's hard to basically piece out or focus on what part of improvements might have come from complementary treatments that were done. Certainly there are some very overstated and unsubstantiated claims that are commonly made, but there may be some merit. Again, very difficult to evaluate from a completely scientific standpoint, but certainly if we look at these as complements and not as alternatives, I think that they definitely can have an important place, especially if we consider that these complementary treatments are, even though they may be a little bit invasive as far as using needles and doing manipulation, but generally they are considered very minimally harmful. And definitely there are some strong indications for especially chronic back pain in horses. Relatively recently in human medicine, there's been an approach to try to integrate medicine into what's called the osteopathic manipulative medicine or integrative approach, and it attempts to include some of these complementary treatments, again keeping it on a rational and evidence-based rather than trying to make claims that aren't based on some type of scientific evidence. The goal with these is to try to look at the patient as a whole and to try to bring a patient back into overall health or homeostasis. So by integrating these, even though they are more time consuming and can take more effort to try to look at the whole patient, they are definitely more helpful and universal in approach and can oftentimes come out with a better outcome and client and patient satisfaction. If you have any other questions about this or other things, other videos that we have, feel free to give us a call here at San Luis Rey Equine Hospital or go to our website.